Welcome, everyone. Thank you for joining us for today's webinar, Beyond Hot Flashes, the Power of Nutrition and Movement in Menopause. We're still a bit early, so I'm going to wait for one additional minute to give people time to join. But I just want to share, you are going to receive so much information today. It's an amazing webinar, a lot of information. So welcome, welcome, welcome. All right, so we're going to start. Hello and welcome everybody again to today's webinar, Beyond Hot Flashes, the Power of Nutrition and Movement in Menopause. My name is Brenda Dash and I'm the Senior Wellness Education Manager for WorkWell NYC. And before we start the webinar, I just want to share some information about who we are. And when I say who we are, I'm talking about WorkWell. So WorkWell NYC is the city's worksite wellness program, and I'm happy to share we've been here for 10 years. We're celebrating our 10th year anniversary, and we are here to help you live well and work well. Our goal is to create work sites that make it easier for our employees to live healthy, active lifestyles. And as we all know, health is not just the absence of disease. Health is physical, it's mental, financial, emotional, and we know that health exists on a spectrum. So we, WorkWell, are here for you with health and well-being resources and programs to help you move more, eat well, be well, and take action to prevent disease no matter where you are on your health journey. We're also committed to addressing matters of inequity and providing platforms to educate and develop structural solutions to health and wellness, both in and out of work. So again, welcome, and we're so excited for you to be here. So today's webinar is brought to you in collaboration with Plant Powered Metro NY. So I'm here to introduce Karina Purse, and I just want to give you a little bit of background about Karina. So Karina is a nationally board certified health and wellness coach with nearly 3 decades of experience in plant-based nutrition education, program development, and community engagement. She has worked with Whole Foods Market to organize its Health Starts Here and Wellness Club programs, trained with leading lifestyle medicine clinicians, and provided health coaching to patients for 7 years at Ethos Primary Care. Karina holds an MS in Organizational Development from Stevens Institute of Technology and currently serves as a virtual engagement manager for Plant Powered Metro New York, where she produces engaging educational webinars in Spanish and in English, focusing on emerging research and practice in disease prevention and treatment. So welcome, Karina, and thank you again for collaborating with WorkWell to bring this amazing webinar today.
Thank you, Brenda. It's always wonderful to work with you, and thank you for the kind introduction. We're so glad you've all joined us today for this important conversation about nutrition and gynecological health. If you want to explore the powerful role that nutrition and lifestyle strategies play in managing common symptoms and supporting long-term well-being, from hot flashes to bone health, metabolism to mood, you are in the right place. Get ready for an engaging and informative session. On behalf of WorkWell NYC, I'm honored to introduce Dr. Elizabeth Fontaine. Dr. Fontaine is double board certified in obstetrics and gynecology and lifestyle medicine. Earlier in her career, she led a lifestyle medicine clinic at Northwestern Medical Center in Vermont, integrating obstetrics and gynecology care, women's health, and weight optimization. After observing declining health outcomes among so many of her patients, she implemented a lifestyle-focused intervention program with strong results. Since joining the American College of Lifestyle Medicine in 2013, she has emphasized whole food plant-based nutrition and sustainable behavior change in the programs she has led and in the patient care she has provided. Today, as CEO of Let's Lead, she coaches physician nurse executive dyads and emerging health leaders and also provides group-based virtual patient coaching. It is my honor to introduce Dr. Elizabeth Fontaine.
Well, thank you very much. And for all of you that are listening, welcome. Thank you for being here. And the little accent you hear is French. I'm French Canadian, but I've practiced in Vermont all my career. I want to say thank you for Work Well and Plan Power to invite me. It's very nice to be here. It is amazing the information that you guys have at Work Well and Plan Power regarding nutrition, exercise, and wellness, something that did not exist when I started my practice. So I want you to know that as a physician, I've learned a lot in lifestyle. So here we go. So today I want you guys to be curious, to put question in the chat, and I will give you lots of different information. So try to pick up something. Don't try to understand everything, but take something that will be interesting for you. I'm sure that there's a lot more women than men in this webinar, but thank you if there's few men that has the courage to be here to understand what women has to go around. So we can go to the first slide.
Great. Did you want, okay, yep, first slide.
So I want you to know that, it is important that we change our narrative regarding menopause. So it's been something that has been pretty hidden all my career. It is still stigmatized. And this is a very interesting, please don't be judgmental onto this video. It's to be fun. And we did attempt to play it prior to, and I'm not sure you're going to hear well, but if it doesn't work, we'll stop it and give you the link. But it is a funny one just to get you in the mood. So please go ahead, Karina.
Shutting down inside, I can't sleep, and so is she. God's ready, thighs. This is my demise, you see. I'm just asking for sympathy because a hot flush comes, memory goes, mood is high, then it's low. Every day more hair grows where I don't want it to be. For me. Mama, it's menopause. No more children can be bred. Now my ovaries are dead. Mama, no, it's not much fun. I once was hot in quite a different way. Mama, ooh, don't know if I'll laugh and cry. I can't remember my plans for tomorrow, and my breath has all gone. My brain is feeling scattered.
Karina, you can stop it there. I think that everybody has pretty much good idea. So please, we'll put that, you'll have the link, and it's really worth it to listen to it when you hear the music well. And she's a funny one. Just to, please don't be judgmental, but it's worth it to see these things. This is the way we usually discuss menopause. So take the time, you're going to have fun to look at it. So we can go to the next one. So here's the topic that we will discuss today. So the first thing is, please, what is it? I'm going to decrease so that I can see only me and see well my screen. So in the chat, please, what is it that keeps you up at night? What do you feel the most? Put in the chat, Karina, toward the end. We'll keep a few minutes for question, and I hope that we'll have time to answer all your questions. Then we're going to talk about the menstrual cycle. You guys have seen that when you were a teenager at school, so it is time that I give you a little bit. We're not going to spend too much time. What is it that impacts the most during your lifetime? And it is not just the hot flashes. So we want to review some of the important elements. So what you eat, what to move, the menopause replacement therapy, there's a lot of different things that just happened within the last year, and I want to touch base on that. So you can go to the next one, Karina. So do you feel that we don't understand too much regarding your menopause symptom? If you look at this, 7% of physicians feel that they're not prepared, or there's only 7% that feel prepared. And 20% did not receive any teaching or education. This is the same thing with nutrition. So when you go to the physician, please try to be bold and selective to the physician that you know something about the hormone, menopause, exercise, nutrition. Next. So here's the very simple. Don't pay attention to all the name hypothalamus. When you reach teenager age, about the brain starts sending signal to your ovaries that you see below. It then has into those ovaries a lot of what we call follicle that contains the hormone that helps you to have your cycle and eventually potentially be pregnant. And then you can see down below, you have the estrogen and the progesterone. So very simple. This is so well orchestrated that usually for a lot of us, this is something that happened within a 28-day cycle. Go to the next one so you can see what really happened. Here you have a menstrual cycle. You have two phases, the follicular phase that we call and the luteal phase. Again, don't get caught in the name. At the top, you have the hormones, and let's put attention, let's see for us the estrogen and the progesterone. So you see that the progesterone rise during the follicular phase. Go one layer below, the ovarian cycle. See those little round things are the follicle. At some point, one dominant follicle is chosen. And in the middle, you see it's the ovulation. When you ovulate, the second hormone comes in, the progesterone. And below, you see what's happening inside the uterus that we call the endometrium. So you see they put at the beginning the period, but really what you want is to see that the inside lining is growing. And when you get to the very end of it, both hormones are dropping and trigger a period. So this is, like I said, very, very well orchestrated, fantastic. Our mind, body, hormones just play this fantastically. Go to the next one. So here's what happened when you get to the age or around the age of menopause. You can see the hormones on the left that are starting to be all over the place. It doesn't have this beautiful pattern that we had previously. And the menopause, which is described or definition, is when you stop completely having your period for over a year. So that's just a definition. But you can see that prior to menopause, you can start having those fluctuations of hormone that will give you all the symptoms that I will talk about with the irregular bleeding. And then the menopause comes in. There's low level of estrogen and progesterone. The brain is trying to tell you, the ovaries, to secrete more hormone. It doesn't happen. And then you start having some of the element that we will discuss today. So that was very simple reviewing, but hopefully that is helpful. Next one. So here's the biggest reason women comes to see me are these ones. There's a lot more, but the majority will come with hot flashes, the night sweats that does not allow them to have good sleep. There's often, mood issue related to anxiety or even depression. The vaginal dryness comes a little bit later when there has been low estrogen for a certain time, and it becomes pretty hard to have sexual intercourse. There's weight gain. You're going to see, I'm going to review all this with a change in our weight distribution. There's urinary symptoms that will make you having what we call overactive bladders. You tend to wake up a couple of times at night to go to the bathroom. Urinary tract infection, the UTI is an infection, a little bit more because of the dryness. And then you have dramatic change in your period. For some women, it's just goes down and disappear. For some of us, pretty heavy bleeding that are quite irregular. Then you have what we call the brain fog. So these are the symptoms that bring women to see us to discuss menopause. We'll go to the next one. These are the ones that will impact most of your life. These are the ones I want to discuss today because I want to make sure that you know about these. And picked up, like I said, be curious, picked up one thing that is important that you can research and talk with people. Cardiovascular disease. You're going to look at the next slide, not yet, Karina. Cardiovascular disease is the leading cause of death in women. I want you to close your eyes and repeat that. Cardiovascular disease is the leading cause of death in women. That is not ovarian cancer, that is not breast cancer, it is cardiovascular disease. Weight gain, I'm going to show you again something to demonstrate where the weight gain is when we call visceral fat is around the inside, not under the skin. Then the bone loss, the osteoporosis, and what we call the sarcopenia, which is the loss of muscle mass with age. All these that you see here are significantly affected by hormone levels, more specifically, estrogen and also a little bit of testosterone. Next slide. So here's what you see, and I mentioned to you the importance, cardiovascular disease, 45%, and look at breast cancer and other cancer and other cause. Cardiovascular disease in your mind, make sure you understand these are minimally genetically related. Cardiovascular disease is related to our lifestyle, what we do with what we eat, how we move, the stress, the sleep, but probably one of the biggest one is definitely what we eat and our movement. So look at this slide and understand that when you hear somebody, when you hear a woman that died of cardiovascular disease at 52, to me, it's a shock. Next one. So let's review also a little bit of information about cardiovascular disease in menopause, so affected by the low level of estrogen. Next one. So here's the study, the Farming M study is a very long-term study that started in 1943. And when you look on the chart, you see that different age, and you see that one is pink, where the premenopause, I mean, before you lose your hormone and after when you lose the hormone. See how much the importance and increase of cardiovascular disease, not only with age, but with the fact that you're losing your hormone. So some women will have a menopause less than 40, not very common, but they already at significant risk during their life to develop cardiovascular disease. Next one. The next one is the same, it's just to reinforce, but one thing that is important, you know how important your cholesterol is? See the relationship of cholesterol with what you eat. So if you look on the left, the people that are meat eater versus, let's say, totally on the right, what they call vegan, which is more like plant-based, the risk of cardiovascular disease is a lot lower. So the EPIC study is a study that is done still in Europe. Over 25,000 people have been studied regarding the impact of what you eat. So it's good to see if you eat meat. The thing with meat is that there's a lot inflammation. So we need to be careful how much we eat meat. And in North American society, we tend to eat a lot more meat than the plant-based diet. Next one. Again, it's a good example of the impact of cardiovascular disease. These ones are more related to, let's say, on the right, if you smoke, so that's probably one of the worst. But the physical inactivity is huge. So it's very important that you take time to move, and it does not have to be as much, let's say, as 10,000 steps a day, because sometimes it's a limiting factor for some people thinking that, oh my gosh, I have to reach that level. Listen, anything, movement is important. And the same thing with the cholesterol. And this one is quite a bit related to everything, inactivity, what you eat. Stress actually could increase your cholesterol. So again, cardiovascular disease is a very important element that you need to pay attention after any time, but after menopause, the estrogen plays a significant role. Next one. Okay, this might be a concept that you're not too familiar. But when you get to menopause and the estrogen decrease and the progesterone, we become what we call insulin resistant. That means that the muscle that usually use the glucose and the insulin is what transport the glucose to your muscle. In the muscle somewhere, there's a receptor we call that is blocked. There's somebody that is there saying, nope, you can't enter the muscle. So that the glucose that is supposed to be in the muscle stays in our blood and then is eventually transformed. And we may have fat accumulation, which, as you can see in the bottom, could be related to prediabetes, elevated cholesterol, and just to have fat increase our inflammation. So we realize that lots of different things happen at menopause, not only the hot flashes that everybody is talking about. So we got to pay attention to this time, and the impact is often to be a little bit more active in order to allow the muscle to grab the glucose. All things that you don't think, you don't see, but I just wanted you to have an idea what is happening that I tend to gain weight. So I think the next slide, Karina, demonstrate pretty good. So see, this is a good, what happened of the fat distribution at menopause. So you see the visceral fat we call is what we gain, the fat we gain inside the belly versus what we call the subcutaneous fat. The one that causes inflammation and is related to many of chronic diseases is the one inside our belly. So we tend to measure the weight, what we call also the BMI, the body mass index. But one that is hugely important now that we discuss more is the abdominal circumference. So if you see, oftentimes I follow women, their waist stays the same. I measure the abdominal circumference that is going down, the inflammation is going down. So this, for any reason, we tend to be a lot more susceptible to gain the fat in our belly with the decrease in estrogen and most likely what I showed before, the insulin resistance. So next one. Muscle also, so we talk about weight gain, we talk about a cardiovascular disease. This is just schematic to show you the muscle with a CT scan when you're very active. You see in the top, when you become inactive, you see that the fat is gaining much more predominance. But if you remain active, the muscle has a much better chance. And we lose a lot of our muscle significantly starting at time of menopause. The estrogen has a huge impact in order to help you with the muscle. So you got to try to do something, moving a little bit more in order to keep your muscle mass. Next one, Karina. So here's the bone, the association with menopause and the loss of our bone mass, what we call osteoporosis. Again, don't pay attention maybe to all these scores, but you know, when you go for a measurement, you see that the normal bone has this nice whole structure. And when you get to osteoporosis, you see it, it's much more open and then at much higher risk for fracture. So again, it is significantly affected with the decrease in estrogen, and it's an indication, I will discuss it at the end, to use a hormone in some women. I'm a good example. I'm a very thin woman that is at risk of osteoporosis, and a good indication for hormone therapy as long as I don't have contraindication and I don't have many chronic disease. So next one. So the three elements that I mentioned here, how much fat we tend to gain into our abdomen. I put the number, you don't have to learn them, but I just want you to see that. See how we decrease our lean mass, 0.2 kilogram, which is, 1.5, 1 pound per year, and the bone mass that is decreasing. It all put us at risk for being weak, and the quality of life is significantly affected. So we need to be proactive. Next, Karina. So how can we be proactive to change everything on our favor? So I think that nutrition is hugely important in the movement. So what wasn't necessarily discussed before medicine, I studied kinesiology, and I have a master's degree in exercise physiology and obesity. So 30 years ago, I was already in this field and very interested to help people to remain active, which brought me to support women with changing their lifestyle in my own practice. And I became a physician with lifestyle medicine. So I was the first physician in Vermont to be credentialed in lifestyle medicine. It's frustrating to realize as a physician that I was not aware the importance of plant-based nutrition. We tend to encourage people to be more plant-forward as opposed to be drastically vegan, which is often will be not so well received. So it all depends of the level of chronic disease, but if you could just keep in mind having an idea that you try to put more plant in your plate, it would be fantastic. So the next one, Brenda. So here's some idea into what needs to be more in consideration for you. So the main driver is to make sure you eat enough. I see often women in menopause that tend to not eat sufficiently. They want to lose weight, so they don't eat much, and they often don't eat the right thing. So you got to be careful. I want you to eat more, and when we talk about macronutrient, we talk about protein, the carbs, and the fat. And pay attention. The protein that is recommended by what we call the USDA has always been about 0.8 gram, but we want you to consider maybe a little bit more. And if it is, please try to observe and check for the plant-based protein, which we will show you a few examples. So again, it's because women tend to eat less and not eating the right thing. Often I will see women skipping. I'm not against the fasting for some women, but a lot of you do not eat properly. And when you eat a meal or you skip a meal for different reason, when you jump to you're so hungry you will eat anything. Pay attention to what you put in your mouth. As far as the carbs, this is what we call another way. People get confused. Sugar. Put attention to try to use a complex carb, which is whole grain. Try quinoa, try brown rice. I'm not sure to what extent you guys are familiar with that. Fruits and vegetables, huge. If I was to ask you just to check how many serving of fruits and vegetable you do a day, the majority, I think 10% of the American population reach it. So count it, just check it yourself. It's very easy to use an app. One is, and I'm not advertising, MyFitnessPal. There's a section that is free. It allows you to get an idea. What am I eating? Or Chronometer, same thing. There's a section that is free. Just put what you eat and look. Try to learn how much you're eating to give you a good sense of what do I put in my mouth exactly. You will be surprised. You will be surprised. So next one. So here's some example of some of the plant protein. I'm not going to show you meat because I like you to have an open mind to something different. Perfect. It's in green at the top. This is well for today. So we're making green our mission today. So look at some in it. Fantastic because it also gives you the idea of how much protein there is. So as an example, if you were to try something that you've never done before, like maybe a tempeh, maybe you didn't even know chia seed has some protein. Peanut butter, I'm sure you're familiar with, and the tofu. But there's some other, like the edamame. If you take them frozen and put them in a microwave, put a little bit of um, some vinegar on the top and eat it before your dinner. This is a perfect appetizer that has a fairly nice amount of protein. So explore, make some little change, try something every week, decide of a meal that you would like to do a plant-based and go progressively so you get used to a different nutrition. So next slide. So I think this, okay, so we have one that has recipes, probably the next one. So make sure fiber, again, is a huge important one. I hear a lot of women that has problem with constipation. Fiber is helpful also for the cholesterol, but fiber comes from fruits and vegetable and some of the plant-based I just showed you. Again, if you have the chance to use the app, just to give you a chance to know, well, how much fiber am I really eating every day? So 25 gram is the amount recommended for women. I can tell you that I can't remember the number. It's probably 20% that really reach this number. So just show you that we need a lot more fiber. The vitamin D, it used to be a time where every physician will look at me and laugh because I was measuring vitamin D. I would assume now that this is much more common and it hasn't been done for you. Please ask your physician to measure it. This is about a good number, the 50 nanomole. After menopause and maybe a little bit after, we tend to decrease the level of, so make sure that you have your physician check the vitamin D. The best source is sun, but you know, we always use cream to protect, so it's a little bit harder. So sometimes the replacement with supplement is perfect. Calcium, we need to increase a little bit when we're in menopause, but I do not recommend supplement. I want you to be careful and eat more green leafy vegetable. Broccoli, Brussels has a lot of calcium, and many studies had shown that women in other countries do not eat as much calcium as us, and their level of osteoporosis is less than us. So it may not be so much related to the amount of calcium. So the next few one are a little bit more like what we call the cruciferous vegetable to support the estrogen. Some women don't want to use at all hormones, even if they're good candidates. So you can make an effort to use some of these vegetable that will maintain a little bit more the estrogen. And I'm putting at the end, it's probably just one study that had revealed that a plant-based diet was associated with soy was substantially helping with the hot flashes. So if by any chance somebody is totally doesn't want to use any hormone replacement therapy, then they can certainly attempt to use and eat a little bit more soy. Next one, Karina. So here's a simple example of, let's say, a tofu scramble. I eat tofu scramble probably 3 times a week. And I use different variation. It's never the same. You can put black bean, you can put no black bean, rice, any kind of bean you want. The baby spinach is good. Mushroom is excellent. The turmeric, I always put it. So you have a lot of option. And if you're somebody that likes to cook and do different things, give it a try. At the beginning, a lot of people say, ugh, tofu. Well, you will see that after a certain time, especially with the turmeric, you don't even see the difference between an egg scramble, scrambled egg, and a tofu scramble. So give it a try. And I believe that there's other recipe that Karina can offer for some of you that would be interested with a more plant-based option, then that would be available. Next, Karina. Okay, let's talk a little bit about exercise. I'm checking the time, right? We're still good. So here's a recommendation of the American Heart Association and the American College of Sports Medicine to do at least a 30 to 60 minute of moderate activity. Or a little bit vigorous activity would be 75 to 150. So about 30 minutes a day is not excessive, and that's about what we would encourage you to do. This is to maintain some level of physical cardiovascular recognition. In order to lose weight, it would be different. So I'm not going to necessarily tell you what we need to increase for the lost weight. But again, at the end, you can see resistant training is one of the things I want a review with you, which is mainly more lifting a little bit more weight. We tend to not really liking the element of lifting weight in the gym. I would like you or encourage you to do a little bit more than ignoring the gym and the resistance training. Increase a little bit more the weight that you use. I was with my sister last weekend. I saw in her house, and she's in Vancouver, so very far when I traveled, had a 2 and a 5 pounds. And I said, well, you know what? If we want in menopause to maintain our muscle mass, it is okay to start if you've never done it with 2 and 5. But then I want you to increase a little bit, certainly making sure that you do the movement properly and no injury, but you have to do a little bit more than a 2 5 pound in the usual 12 15 rep that they offer you. So as you can see, there's only 24% of the population that meets the guideline. So let's check the next one. So here's some names that I would like you to have in order to help you. So instead of going to social media and listen to everybody that sometimes may not be as knowledgeable. So I recommend this book, Next Level by Dr. Sims. She's an exercise physiologist. Really, this book is really related to exercise after menopause, so it's very good. And I had the chance to talk with Stacy because I went to New Zealand where she lived. So and I'm sure that I think I just saw it in the chat. Stacy's everywhere in YouTube or whatever. Rhonda Wright, she's an American ortho physician. She's out there quite a bit also. She one of the first that described the association of losing estrogen and what we call the musculoskeletal syndrome of menopause. So a lot of shoulder problem, what we think is related just with age, could be related with decrease of estrogen. And she is very into demonstrate some exercise as well, and is also Dr. Kelly Gasperson. So those are good names for you to review if you want to. It's always useful to have names. Next one. So this is example that Stacy Sims, like I showed you. So I'm not expecting any one of you to do exactly that. You can do more instead of doing only, let's say, an hour easy walk. That's usually what majority of women do. I would encourage you to be a little bit more like a sprint interval, which is a short burst of strenuous exercise. Now, short bursts of exercise for some of you could be as simple as going from one telephone pole to the other one faster. For some of you, it could be run a sprint as opposed to just do a jog. So that's what you need to be careful, but we know that the sprint interval has a much better impact into the intra-abdominal fat than doing, let's say, an hour of easy walk. So you could do half an hour and do a little bit more of the sprint and be a lot more impactful. I just mentioned that. Lift heavier. 5 pounds, 2 pounds at the beginning, very good. But I want you to progress. And instead of doing those 15 reps, 6 to 8 reps with a weight that will be a little heavier, 2 to 3 times a week. You may hate it at the beginning, but eventually you're going to start enjoying it. I'm a good example. Never enjoyed lifting weight. I'm a long distance runner. Eventually, with age, you can see me, I'm thin. So I have to fight constantly to keep my muscle mass. The jumping is huge to prevent and help your bone. So it doesn't have to be a huge jump. If you have the agility to do jump rope, great. Another easy example is just to jump in place, or you just choose the very last step of your stairs and you jump down 20 times. All these pressure element on your bone strengthen your bone. Very simple, but it works very well. Next one. So here's the important thing, the message that I want you to remember. The whole plant-based, like what we encourage more like a plant-based forward, is significant to reduce cardiovascular disease and chronic disease. So if you're somebody that has chronic disease, diabetes, high blood pressure, we can reverse the chronic disease by using a different diet, a plant forward, and eventually even a whole plant based. Eat more protein, eat the right protein to maintain your muscle mass in the bone. Lift heavier, I told you that many times now. And in order, like I said, to find the best balance for the muscle and increase your metabolism, and so that you can feel good and look good. When you start having a little bit of muscle, especially after 60, not bad, we like it. So here's something I want to say. There's a little bit more to say. Next one, which is very important. So we had a lot of discussion regarding hormone for the last 20 years. And I've been involved into this. There was a study that we call the Women's Health Initiative that separating for facts and fears is important here. So you can go to the next one. So here's what happened with this study that was in 2002. And the result, unfortunately, that spread was not exactly what should have done. And we need to change all this, which took over 20 years. The participant in this study was way after menopause, 63. They had already risk, diabetes, high blood pressure, overweight, smoking, diabetes. So it made it a high risk to take any hormone. Breast cancer, you can see there was only one additional, which was non-fatal. And in the group, if you remove woman a uterus, you don't have to give the progesterone. If you only give estrogen, the study demonstrates that they had 20% lower risk. Did you capture that? You take estrogen if you don't have a uterus, and you actually decrease your risk of breast cancer. That is significant, very something definitely people are not aware. And now we don't use a combination that was used in the study of Premarin that we call the conjugate equine estrogen and the methylprediction acetate, which is Povera. We rarely use these hormones. Next one. So in the menopause hormone therapy, it's time to move beyond outdated fears and misinformation. We need to empower you women. With education and the choice, you need to be able to see a physician and that knows about women more and take informed decision about your own health and your well-being. There's only a few contraindications of menopause hormone therapy. Next one. So this year, the Food and Drug Administration removed the warning, finally, after 20 years, the black box warning previously that advised against hormone for cardiovascular disease, breast cancer, it was removed. Amazing. The update guidance label now emphasizes that hormone replacement therapy can benefit the heart, the brain, and bone. So it is time for you ladies to change the narrative and feel more comfortable about what you want to discuss with your provider. Next slide. So here's the recommendation of the North American Menopause Society. So for women aged younger than 60, so within 10 years of menopause, Onset and has no contraindication of hormone. The benefit, let's just repeat that, the benefit outweigh the risk. So it is better to take hormone than not taking them. The indication is for treatment of what we call vasomotor symptoms, like the hot flashes and the night sweats, prevention of osteoporosis, an important element that cause significant decrease in functionality of women after menopause. The premature hypoestrogen, that means women that has their menopause, let's say at 35, 40, it happened. These are candidate for hormone. The symptoms of dryness in your labia, vaginal dryness that prevent from having sexual intercourse, and of course, personalized treatment. I'm not saying here that every one of you need to run to their physician and ask hormone. My first level is definitely lifestyle. The reason is that I see a lot more chronic disease than I'm used to, and I told you prior that this is related a lot to our lifestyle. So that's my first big discussion. On the other hand, I want to make sure that women understand that if there's no contraindication around menopause, is the best time to try to support you with many of your symptoms. So let's make sure you understand that. Next slide. So here's are the information of some of the literature so that you have it, and some books that are recommended. So I'm sure that you will have the chance to have all this. And that gives us 15 minutes for questions. This is amazing. Right on time.
Thank you so much, Dr. Fontaine. Let me
My
get my,
pleasure.
I'm coming back online slowly. We have lots of great questions. Um, I know you mentioned, so some people have been asking, instead of what was recommended, the conjugated equine estrogen plus that progesterone acetate fancy thing, what is being recommended now in terms of HRT?
Well, the majority, and you got to be careful. A lot are talking about, natural hormones. A little bit confusing, but I want you to know the estradiol. Estradiol, that's one of the medication, quote unquote, that we use, is a natural hormones. This is exactly the same as what our body produce. So estradiol, that's the and the other one is simply progesterone. So if you go to your physician, they should be able to not necessarily talk about bioidentical, because estradiol and progesterone is what your body produces. So don't, and it's a good question. Thank you for asking that. There's lots of confusion thinking that the bioidentical will be better than the one I just told you. The bioidentical is going to be a lot more expensive, and the estradiol and the progesterone are very just the natural one that our body produce. We're probably going to encourage not necessarily to take them by mouth, because the estrogen is goes through the liver, and potentially, again, that's a potential, could increase risk of blood clots. So often we will encourage to use what we call a patch that you can put in your body, on your body. Sorry about that.
Thank you. That is so helpful. As you can probably guess, many of the questions center around brain fog, night sweats, and trouble falling asleep or staying asleep.
So the first level that I use, as long as there's no contraindication, so I don't have all this story, but one of the first one that is very helpful is the progesterone. The progesterone has a gamma receptor in your brain that support and help us with sleeping. So instead of using both hormones at first, because it seems that the progesterone is the first one to start with huge fluctuation, I tend to use progesterone at night. Obviously, it helps with the sleeping. So I use 100 milligram of progesterone at night at the beginning. So it has a significant response to support the sleep. So that would be my first choice.
I wonder how many of us are going to get on the phone right after this presentation. I know I will be. Thank you for this help for sure.
My pleasure.
Here's a great question. If someone doesn't have any issues yet, should they see a cardiologist in their 40s for a baseline?
Not a cardiologist. I think your primary care physician, if you don't have any history, is good to measure the fundamental of a lipid profile. So it's already pretty good only at 40, unless you say you're 40 and for any reason you have, like I said earlier, premature menopause, then that puts you at risk. And that would probably be more, hopefully, your gynecologist that knows a little bit more. But I will admit that even me as a gynecologist, until I had the chance to know a little bit more about nutrition, which I am part of the lucky group that wanted to know more.
That's great. Thank you. I wanted to add that when I first heard Dr. Fontaine give this presentation a year and a half ago, maybe almost 2 years ago, I was not eating edamame, but I took her recommendation and I was definitely not, in my early 60s, eating the recommended amount of protein. And I started adding beans to each meal as she recommended. And I do feel a lot better. So I just want to say that you may not love edamame right out of the boat, but if you keep eating them, you will like them.
Oh,
So
good, Karina. Thanks for telling me.
yeah,
In itself, I recommend to use those apps. I'm the one that use them. And I tell you, I know that I'm doing exercise. I'm fighting every day to maintain my protein level. So it is, I mean, obviously I could eat a steak, but I'm not really a steak
yeah,
eater. And to the point, you have to be careful to choose well what you eat. So a very important element for women that are listening.
I agree. And the app that I'm using, as you mentioned, is Chronometer, and there's also My Fitness Pal, and it's very eye-opening. It'll show you all of your nutrients, and the more leafy greens and vegetables and whole grains that you're eating, as Dr. Fontaine recommended, you'll see your nutrient levels just soar. It's really, really incredible, and you can also track your protein, and it's free. So Chronometer and My Fitness Pal, those are great suggestions. So this is probably a really common question. One of our listeners went 7 months without a period and was probably hoping that this might be it. And then a period came and she's back to counting again. So she said, what do I do? Do I just prepare every day as if I'm going to have a period? I love this
Well,
question.
I mean, and in her circumstances, it's unlikely. But when you remember when I showed the schematic, so your brain is sending those high level of hormones to the ovaries, and by any chance there's a little follicle that is still not, alive, then it will come out and give you sufficient amount of hormone in the period. I mean, if it's been 7 months, you would think, it's hard for me to say, oh, absolutely not, but most likely she's not too far from the menopause. And you don't have to wait until you're completely without period if you have symptoms and you would like to discuss treatment. But and all the other things that I've discussed, it's even if you're not in menopause, the better is prevention. So all of you that have young girls, tell them to start eating the best thing. You know how much we're eating fast food nowadays? Encourage them to try to understand the importance of the good nutrition and the movement. So it start early. And if you get to your menopause, you already have an interesting muscle mass. You certainly have better chance to maintain. Oh, Brenda's showing up.
Oh,
I
She
see
yeah,
Brenda.
and I'm saying I'm so sorry to interrupt, but time is coming. But I do want to share that Dr. Fontaine did. She's so passionate about this conversation, this important conversation, that she did share with me that she would be interested to come back and to do a follow-up where she answers many of the questions that you've submitted in. So if that's something that you all would be interested in doing, we can definitely work to get something on the calendar. And I'm seeing lots of responses, so I'm going to
Love
take that.
that. This is great. Thank you guys.
Yeah, so we will do
Yeah,
that. We will look to see what works with Dr. Fontaine, and we'll do a follow-up where it'll be more of a conversation, a discussion.
that would be fun. Fun, fun, fun. Love it.
Yes, so with that said, because we're seeing so much feedback, I just want to get a poll from you all just to see what's your thoughts of today's presentation. So in terms of knowledge, did participation in this program increase your overall knowledge? We want to hear from you because these help us generate programs going forward. You know, it's amazing to have so many amazing topics, but once you all share what you're interested in, at least it can help guide us in terms of future programming. So thank you ever so much in advance for taking this.
It says I cannot vote. That's not fair.
All right, and then I'm gonna give you a few more seconds, and then I have an additional poll to ask. But thank you. And again, thank you for the questions. I see quite a lot pending. So I'm going to end poll. I'm going to go back and then I'm going to do program satisfaction. How would you rate the overall quality of this program?
Am I going to see the result?
Definitely, I'm going to share it with you,
Thank you.
Doctor. Ooh. Can people, for some reason, let me go back.
Up the
This
survey
one's
disappeared.
not going through. Program satisfaction. Ooh, for some reason, that one did not post.
I
Relaunch.
think it popped up and it went again. Is there a way
Okay, so I
to
just,
bring it back? Great.
I was able to get it. Perfect. Thank you, everyone. And again, it really helps us with future programming and to know, did we knock this out of the box? Are you interested in other topics? So thank you. And I do want to share, you're going to receive the live recording. So everybody will get the recording. And Dr. Fontaine has graciously shared some recipes, high protein recipes, correct? That we're going to attach to the follow-up email.
I think you need to give that to Karina. She's the one that shared all the recipe.
Ah, okay.
Excellent.
Thank you,
Yep.
Karina.
Oh, thanks.
All right. So
Yep, 12 delicious recipes with pictures that Dr. Fontaine did check over a couple of years back and we've updated. So they're very tasty and they're over 30 grams of protein per serving.
perfect. And sometimes it's very hard for us to figure out what to prepare. We hear about high protein, but when we try to figure out, well, what is a high protein meal, it's hard. So recipes are a great source.
Yep.
So before we end, I want to share additional information about upcoming programs from WorkWell. So during these uncertain times, it's important to support your basic needs and find community. So we're having two very important opportunities for us to come together as a community to discuss how we're feeling, to be heard, to learn about city resources that potentially can support us during these challenging times. So one of the events will take place on March 26th at 7 p.m. And the second would be on March 27th at 12 p.m. Sorry. So at least it enables people to participate depending on their work schedule. So hopefully many of you will be able to join. It's a great time again for us to share, connect, and support each other. And as always, we want to hear from you, so stay connected. There's so many ways that you can stay connected with WorkWire NYC. We want to hear from you. Again, this is our 10th year, which is so shocking to be able to say 10 years of WorkWell NYC, and we're so excited to continue this journey with you and to continue being your worksite wellness program. So thank you all. We would not be here if it wasn't for you all. So thank you for supporting our programs. And we look forward to continuing the conversation with Dr. Fontaine as well as Karina. So thank you, everybody.
Yeah, thank you everybody for being here. Thank you for the organization, Brenda and Karina. Really appreciate it.
You're welcome. And thank you, Karina.
Thank you. This was so enjoyable and informative, and it's so fun to get together on a Tuesday afternoon like this, Brenda. Thanks for bringing us together.
You're
Thank you. I
welcome.
love all the heart. That's so nice.
Very
Very
nice.
good.
Bye-bye.
Bye-bye.